Good morning and welcome to my presentation on tobacco cessation health promotion. The aim of a health promotion plan is to benefit the health, safety, and well-being of individuals and communities. This is achieved by resources, tools, and goals. The primary goal is to provide the individual necessary tools to improve their health and quality of life. The purpose of this plan is to give education and resources to put an end to tobacco usage. Health promotion and disease prevention programs focus on keeping people healthy. Health promotion programs aim to engage and empower individuals and communities to choose healthy behaviors and make changes that reduce the risk of developing chronic diseases and other comorbidities. Typical activities for health promotion, disease prevention, and wellness programs include communication, raising awareness about healthy behaviors for the general public. Examples of communication strategies include public service announcements, health fairs, mass media campaigns, and newsletters. Education is empowering behavior change and actions through increased knowledge. Examples of health education strategies include courses, trainings, and support groups. Through policy, systems, and environment, these are systematic changes through improved laws, rules, and regulations, functional organizational components, an economic, social, or physical environment to encourage, make available, and enable healthy choices. Smoking is the leading cause of death and disease in the United States. It causes harm and disability to almost every organ in the body. McClevey, 2017. Millions of people are living from disease caused by tobacco. COPD, heart and lung disease, cancer, and diabetes, just to name a few. 8 out of 10 COPD deaths are caused from smoking, and the leading source of addiction in the United States is tobacco use. The abuse of tobacco is among the biggest threat to public health in the world. According to the World Health Organization, WHO, 7 million deaths annually are linked to tobacco use and abuse. In addition to this, 1.2 million deaths are also attributed to indirect abuse like secondhand smoking. The use of tobacco can cause serious health effects to the abusers. Tobacco abuse is among the leading causes of cancer, cardiovascular, and pulmonary diseases, and other chronic illnesses. Stemming from the difficulty in tobacco cessation, research indicates that tobacco is very addictive. It is in fact the leading source of addiction in the world. Your at-risk populations. Tobacco use spans various age groups. The youth are the most affected by tobacco abuse and addiction. The abuse of tobacco majorly starts from adolescence and extends to adulthood. Tian, 2017. Tobacco can be abused through vaping, e-cigarettes, hookah, chewing tobacco, and smoking. Abuse of tobacco by adolescents can lead to severe brain damage. With the current prevalence of tobacco abuse among the youth in America, the Center for Disease Control postulates that close to 5.6 million citizens below 18 years old, which is 1 in every 13, will die from tobacco-related illnesses. Most abusers of tobacco start during the adolescence. About 1 in every 100 middle school students and 2 in every 300 secondary school students are reported to have used tobacco at least once in their lifetime. Healthy People 2030 Objectives. Tobacco cessation strategies in Healthy People 2030. The inflating price of tobacco products, the increase the number of smoking cessation services in clinical settings, anti-tobacco media campaigns, and increase Medicaid coverage of evidence-based treatment to help people quit using tobacco. Healthy People 2030 is a campaign against the dangers of passive smoking or secondhand smoking. There are several strategies put in place by Healthy People 2030 stemming from the abuse of tobacco. The first strategy is inflating the price of tobacco products, making them unaffordable, especially among the young. The second goal is to increase the number of smoking cessation services in clinical settings to increase access. According to the Centers for Disease Control, anti-tobacco media campaigns are a sound strategy in reducing its abuse. This also includes a stop to the advertisement of perceived less harmful tobacco products, which majorly have been targeting the youth and limiting access to tobacco products. SMART goals in tobacco cessation. What is being accomplished? Why do we want to accomplish this? Is it measurable by how much or how many? Is it action oriented? What needs to be done for us to reach this goal? Is it reasonable? Meaning, is it something that I can do or we can do? Is it timeline based? Meaning, when can I or can we accomplish this? Good health doesn't just happen. It is a result of healthy living each day. We need to determine where we would like to be to make these life changes. Then we follow these 3 simple steps in designing the SMART Health Improvement Action Plan. We identify the area of desired improvement. We write a SMART goal for this achievement. In writing your SMART goal, we want to be specific on what we want to achieve and the actions that we're going to take. We have to determine how we're going to track our progress by thinking on how much or how many when we start implementing this goal. We have to select an action for our goal by identifying what we'll do to achieve this goal. And in setting the goals, we have to make sure that they can be realistically accomplished within a short duration of time. We have to set time expectations by having a start and finish date. And then this will give us a clear target date to work with. Then we formulate a SMART health improvement plan. So let's say we start with our SMART improvement plan by saying we want to maybe cut down on smoking. So we write this goal down. Now, we're not going to say we want to cut down on smoking completely. Maybe we want to cut down on smoking maybe to 2 cigarettes a day. At least this is measurable, saying 2 cigarettes. What needs to be done to reach this goal? Well, we need to obviously quit smoking as many cigarettes as we have been. Maybe in the time that we would smoke a cigarette during the day, we could pick up another hobby such as reading, sewing, something that will take our mind off of the act of wanting to smoke. Is it something that we can do? Of course, we can lessen our amount of smoking by not smoking a whole pack, maybe smoking 6 or the 2 that we had started with. And when will we accomplish this goal? We want to set a realistic timeline, so maybe within 2 weeks, we'll be able to only smoke 2 cigarettes as opposed to 6. Or if we're smoking a whole pack a day, maybe we'll only smoke 8 cigarettes instead of a whole pack. At least we give ourselves a window in which we are able to come up with a reasonable outcome. So these goals can also help, and we can say, so I'll meet with my health coach once a week to touch base and adjust the plan if needed. I will join a smoking cessation program in a week and attend meetings at least twice a week. Instead of smoking on my lunch break, I will go on a walk. Next week, I will be able to list 5 resources that I can utilize for smoking cessation. These are all examples of well-designed smoking cessation SMART health action plans. So, like I had previously stated, we have to ask ourselves, what do we want to accomplish? We want to stop using tobacco products. Why do we want to accomplish this? To live a healthier life and improve the quality of life that you're living. The goal: I will quit using tobacco by the end of the month. Setting specific goals is important in tobacco cessation. Specific goals make the entire action plan achievable. The following examples of specific goals are ones that you can set for tobacco cessation. I will quit using tobacco by using Nicotrol inhalers or nicotine gum to decrease my cravings. How? When craving nicotine, I will use this as a replacement to help myself wean off of tobacco. As the weaning process begins, then we have to move to other options like snacking on fruits, chewing gum, exercising, or reading books. Setting goals without an action plan is like playing a game with no rules to determine the winner. The following are specific actions aimed towards achieving specific goals. A smoking cessation plan should have both specific goals and specific actions towards the achievement of those goals. Quitting tips and tricks. We want to decrease stress to reduce the urge. Change routines that have revolved around tobacco use. Keep yourself busy. Read, walk, or watch a movie. Reward yourself with success. And the 5 Ds. Deep breathe, drink water, discuss, delay, and distract. From Lancaster and Steed, 2017. The following tips can be used for tobacco cessation. Most youths suffer from stress and depression and have resorted to tobacco use to relieve stress and depression. Many tobacco products are presented as stress and anxiety relievers in advertisements, influencing more people into abuse. Many youths are therefore tempted to abuse tobacco when stressed. Stress reduction is a powerful technique for people who abuse tobacco for such reasons. It is also important to change routines that revolve around the abuse of tobacco, such as routines that create the urge to abuse tobacco. Such include gapping to birthday parties or events where there is probability of meeting abusers. Also, keep yourself busy to avoid thinking of abusing tobacco or lonely feelings that could lead you to abusing tobacco. In achieving any set goals, you want to be sure to reward yourself. The brain reward system will ensure that you do not breach your rules. Cessation aspects for change. We want to divide any students according to grade or age, conduct awareness assessments before and after sessions to determine effectiveness, use picture charts and images among students in lower grades, and engage the students in the session to make them more active. Session outcomes to reach Healthy People 2030 goals. We want to eliminate cigarette smoking initiation in adolescents and young adults. We want to reduce the current use of flavored tobacco products among adolescents who use tobacco. Reduce the current cigarette smoking in adolescents. We want to reduce e-cigarettes in adolescents. We want to increase the knowledge and understanding regarding smoking cessation, along with giving resources to help promote smoking cessation and educating on the effects of tobacco on the human body. This will reduce drug overdose deaths and the exposure to unhealthy air. One of Healthy People's 2030's 5 overarching goals is specifically related to social detriments of health. Create social, physical, and economic environments that promote attaining the full potential for health and well-being for all. The above mentioned are objectives and leading health indicators related to tobacco abuse among youths achievable at the end of the education sessions. In line with this goal, Healthy People 2030 features many objectives related to SDOH. These objectives highlight the importance of upstream factors, usually unrelated to healthcare delivery, in improving health and reducing health disparities. So how can we improve future sessions? We want to keep logs of students' smoking cessation assessments to see what worked best for future individuals. We want to collaborate with parents to monitor and provide reports on behavior of students while at home. We want to communicate with parents and communities and determine their concern regarding tobacco cessation among youth. And we want to include motivational talks from former abusers of tobacco. Thank you very much.